I wanted to share with you another important part of our documentation section for CNAI, which is our Medi-Cal Medicare assessment note. So if you go under documents, you can click on Medicare Medi-Cal assessment. In using this with our first-time clients, we can gather all the information necessary in order to build a comprehensive, compliant assessment note for insurance. So we could do live, which we would obtain our client's consent prior to doing this, or dictation. Clinical Notes AI has already put on here prompts for us as clinicians to go through that align with Department of Healthcare standards in order to bill for medical necessity. So we need to show that there's impairment in the client's functioning that aligns with the symptoms and the treatment plan based on what we represent in the assessment. So we would discuss the presenting problem, current mental status, history of the presenting problem, what those impairments are, whether they're in work, education, social, family, any history of trauma, current trauma or abuse, any outcome measures such as the ACEs that we've done, behavioral health history, any prior providers, psychiatrists, psychiatric hospitalizations, comorbidity with substance abuse disorders, medical disorders, which leads us into medical history. What is the client's medical history? We want to make sure that we're ruling out any type of medical impairment, right? Current medications, comorbidity with mental health, social and life circumstances, culture, religion, spirituality. How are these impactful in the client's life? Risks, strengths. Risk factors look at, is there a plan, mean, intent? Do we need a safety plan? If so, there's a document within Clinical Notes AI that we can have help draft a safety plan for our clients. And then we come up with a clinical summary and service recommendations, a treatment plan that we're going to recommend for our clients based off the assessment. With that, we would generate, once we finish dictating. So we're going to use the test one that I created earlier. And you can see it's broken out into sections. So section 1 is our presenting problem, why the client's presenting now. Then our mental status. Some of your EHRs may already have a mental status embedded in it. That's okay. Go ahead and use the EHR checkboxes. Or what you can do as well is once you've generated this document, you can copy and highlight and move over to your EHR, each section as you see appropriate. Any information about family, home and environment, where does the client live, any history of trauma, behavioral health, substance abuse, mental health history, medical history, relationships and sexuality, how that impacts our clients, education and employment, social functioning, strengths and safety factors. Pay attention, do we need to develop further safety plans based on this section? And then a summary. So this can be used in your first session or whenever you need to reassess a client to update a treatment plan or see where you're doing in terms of your progress in therapy. Hope you all find this as useful as I do. Have a great day.